My name is Randa Weeks, and I am the creator and presenter of this presentation. I just wanted to give y'all an overview of what revenue cycle management was, kind of just like the big picture, and just kind of go over the steps. That way, so you can just get the key points out of the full cycle. This is for HITT 2335, coding and reimbursement. Okay, so revenue cycle management in healthcare. So to get a big picture, revenue cycle management in healthcare bridges the gap between the clinical and business sides of the organization. So what does this mean? This is done by linking the administrative data, such as patient's name, insurance provider, and other personal information to the treatment received by the patient. So like the patient demographics are all part of the business side, and procedures performed are all part of the clinical side. Once a procedure is done, that is where coding comes in and attaches the code to the claim. The code that is inserted will then trigger charges from the charge master based on the procedure code, and those charges will be transferred to the claim. Next, the claim is either submitted to the insurance provider, also known as the third-party payer, and then if insurance provider is not attached to a claim, then it is sent to the guarantor. What is the guarantor? The guarantor would be either the patient themselves, a parent, or another selected individual. I've seen where a mom was the primary caretaker of the child, but the guarantor was the father who lived in another state, so any remaining balances would go to the father. Okay, and so next, if the claim is correct and everything's good, the claims are sent through scrubbers and easy format. So patient comes in for patient registration. Eligibility is done and the benefits checked to make sure that everything's good to go. Once that is done, data entry and patient demographics. This is where you would take, if this was a new patient, you would take their name, date of birth, insurance, guarantor information, address, all that basic information for information about the patient. And then if a patient is coming in, say, for a procedure, most insurances require prior authorization. So either if your insurance has a PCP and you're going to a specialist, you have to have a referral. So that's where this comes in. And then in order to have a procedure by, say, if it was your own PCP provider, like if you wanted an MRI, then the diagnosis and the documentation has to meet in order for that to be pre-authorized. Because if you complete the services and it's not prior authorized based on insurance policy, then the claim is going to be denied and the insurance does not have to pay for it. Okay, so after the encounter is done, patient's out, then all the documentation and chart and information is sent to billing and coding. This is where your codes are entered, your diagnosis, and then your procedure codes, which trigger the charges for the procedures that were offered. And then you post other charges related to supplies and stuff like that. Any charge that you can charge that is not attached to a procedure code. Then claims are submitted to third-party payers or the patients themselves. They are sent through a scrubber or a clearinghouse, which pulls out the claims that will possibly be denied. And then if the patients or the claims that are clean, they're sent to the third-party payers, and then the payments are received back, and those payments are posted. And that's the end of those ones that were not involved with the denials, as long as there's a zero balance. Any of the claims that are related to denials will go to denials management. Secondary filing, like corrections, will be made, and then second filing attempts are made. And then once all that payment is resolved, then the accounts receivable will post those payments to complete the charges on that claim. And then accounts receivable, once those are posted, and then anything on the appeal for any of the appeals, the appeal procedures, any claim where it was denied and you're wanting to appeal it. So if the appeal is denied, then any responsibility will go to the patient or be the liability of the facility based on policies and procedures. And so that is a wrap-up of revenue cycle management. I hope that y'all enjoyed this. If you have any questions, y'all know what to do. Thank you.